Okay, today I'm going to be going over the lower extremity arterial scan. I have a super tiny patient for my volunteer. We're just going to try to make that work. So the first thing you want to do, you want to go to the common femoral artery, find that in its long axis, put color on it, take an image, and then also put pulse wave and take the peak systolic volume. Then you're going to want to move down. You're going to want to find where the profunda is, put it in its long axis, put color compare, and then put pulse wave on it and take peak systolic volume as well. And then we're going to move down to the femoral artery, also known as the superficial femoral artery. So past the bifurcation of the two deep and superficial systems. And you're going to take the prox in its long axis with color, pulse wave, and peak systolic volume. Mid femoral artery with color, pulse wave, and peak systolic volume, and then also the distal, just the furthest down you can go before that femoral starts to wrap behind the knee, and you're going to put color on that, pulse wave, and take the peak systolic volume, and from there we're going to go ahead and wrap behind the leg, and we're going to get right there into the popliteal region, and then we're going to take an image, put color compare on, add pulse wave, and take peak systolic volume. And then we're going to go into the calf region, and we're going to find the posterior tibial artery of the prox version of it, put color compare on, put pulse wave on, and take the peak systolic volume. And then we're going to go ahead and take the distal of that as well. Do the same thing, put color on, pulse wave, and peak systolic volume. And then a lot of the times with the posterior tibial artery, you can also pull in the perineal artery. It'll be, because you're in the back of the leg, it will technically be deeper in the image. So you're going to do the same thing. You're going to find that artery, put color compare on, pulse wave, and then take the peak systolic volume. And then you're going to want to find the proximal anterior tibial artery, and probably about in here, and put color compare on, pulse wave, and then take the peak systolic volume. And then we're going to find the dorsalis pedis artery and do the exact same thing. You're going to want to put color on, put pulse wave on, and then take the peak systolic volume. And that will be pretty much anywhere in this region that you can find it.